thumb sucking is one of the most misunderstood childhood habits. So in this video, we'll talk about that and what you can do when you should be worried. If this is your first time, welcome. I am Dr. Nnamani, board certified pediatrician. Welcome to the Dr. Nnamani show, where we prioritize preparation over perfection. So again, let's get into it. So your child's promise, Mom, I promise I won't suck my thumb again. And for some reason, your child, your son, your daughter just keeps going at it. So let's talk about a few reasons why this may be happening. So before we get into it, I think it's important to know, why is my child sucking their thumb? Now, remember, a lot of babies, a lot of toddlers will actually start thumb sucking in the womb. So it's actually a normal process that starts before they're born. Now, a few children will suck because they're tired or anxious, or when they're going through transitions, whether it be small or big. Watch my prior video on toddler transitions, boredom. And a lot of children will actually do it right around when they're about to fall asleep, right? So it's important to understand the why before knowing how to possibly address some of the issues around that. It's also generally common around infancy, the toddler years, like I said, during naps and bedtime. And again, importantly, a lot of toddlers and infants will actually start thumb sucking when they don't feel really well. It peaks between ages 2 and 5, and most toddlers, most children will naturally stop thumb sucking around 5. Even after this age, they can continue to have occasional regressions around this. Now, when should you pay close attention to it? Now, a few things to consider with thumb sucking is that it can actually lead to some dental abnormalities. So if it's a child who is consistently sucking, keyword consistently, right? So some children will do it, like I said, during those transitions, and it'll just be for a few minutes or at bedtime. Now, those children usually are okay, but for children who are consistently doing it, we start to worry about, the dental abnormalities, right? So with the palate, and a lot of our children who consistently suck may in fact eventually need braces. The other thing that can happen is just skin irritation, right? Because so the saliva can really cause a lot of irritation, and they can get like dermatitis, which is really a fancy term for irritation, or even calluses, right? And then the other thing from a social standpoint is that your child may be bullied. So more from like an embarrassment standpoint from their peers in school. And very, very occasionally, you may see some speech issues. This, I don't know that I've really ever seen that frequently. So when your child is over age 5 and this continues to happen, I typically recommend just having like, a team kind of approach to it. So involving your pediatrician, but as well as your dentist and possibly an orthodontist, as the dentist may see fit. Now, how can you stop your child from thumb sucking? Number one is you need to find out why your child is thumb sucking, right? We talked about those reasons earlier, just a couple minutes ago in the video, but is your child doing it because they're tired or they're bored, or is it something else going on, right? Is there a transition? Is this a soothing thing for them? So they do it like right before they go to bed. Now, as a parent, it's important to validate those things. And I know as parents, we have like 1,000,001 things thrown at us. And sometimes you taking even a time out for yourself before addressing that can be helpful. Avoid yelling at the child or making fun, like, you're a big boy, you're a big girl, why are you doing this? That is almost always counterproductive. So don't ever do that. Don't be punitive. Don't punish because you're doing it. Just try to come down to your child's level and try to understand why they're doing it. Now, the next step when you figure that out is to replace the comfort. So if it's your child's doing it, which is really very common in most toddlers, right, is that they'll do it when they're tired or bored or about to fall asleep, is you can actually just gently take the thumb away or whatever other finger. A lot of children will suck the thumb or actually these two fingers, right, your ring and your third finger. A lot of children will usually go between those two, and some children will actually just do the index finger. So try to replace that with something like, you can get them a cuddly toy like a stuffed animal or a blanket or like some kind of sensory toy. And if you don't have access to any of those, you can just give extra cuddles, like a really tight squeezy hug, right? Or a bedtime back rub, or you can just do like breathing games, right? So you don't need to go all out if you don't have access to getting or purchasing items. You can just, you as a parent can be a little bit of that comfort that your child needs, right? You don't really want to stop a behavior and not have anything to replace it with. As that goes for the same for adults. You stop doing something, but you got to replace that habit with something else. So it's really important that you do that. Now, positive reinforcement is very important. So we talked about not being punitive or, wanting to punish your child. So on the flip side, you want to use positive reinforcement. What do I mean by that? So you celebrate little wins, like, oh, Johnny, I realized you didn't suck your thumb today, or you did it for a shorter time. Let's have a sticker chart for every time that you don't do that. And again, if you don't have access to a sticker chart, you can just use a good old board, whether it's a blackboard or a whiteboard or just a sheet of paper. You can get creative with it, right? You don't have to spend funds if you don't have access to that, right? So celebrating those really little wins. As humans, we actually do a lot better with positive reinforcement than we do with punitive measures, right? So avoid having perfection expectations, like, oh, you did great yesterday, but okay, you bombed yesterday, and so you're not going to get that. No, you can find out, okay, he's done great for 4 straight days, but he had a lapse for 2 days. What's going on? Is there something else I should know? And really importantly, try to involve your child, especially if your child's like a preschooler and verbal. Find out again what's going on. Find out what's important to them, right? For some kids, it may not be stickers. For some kids, it could be just more time with you as a parent, or they want big girl underwear, but big boy underwear. Just try to make it specific to your child's personality so that you're more likely to be successful, right? And then importantly, try to focus on the daytime first versus the nighttime. So if your child is usually sucking their thumb or their finger as a soothing thing just before bedtime, it may be more difficult to get rid of that habit versus if they're doing it during the day when they're bored or watching TV, right? Again, talking about watching TV, you know how I feel about this. I'm not big on screens, especially in children under age 3. I'd rather them read a book or explore their environment. But if you're watching something, make sure it's something educational, right? So if it's, try to stop it during the day versus at nighttime. Now, the big question here is, what happens, because I've had a lot of parents ask me, can I just use like bitter nail polish or something really bitter on their fingers in the hopes that they'll just associate that taste with not wanting to do it? Now, that's kind of a tricky one. So number one, I'm not big on that personally. I don't recommend that. But very importantly, if you're going to attempt that, make sure it's something that's safe for your child. So I'm Nigerian originally. So in our culture, there's something we call bitter leaf. So some moms may actually just squeeze that leaf onto the child's finger, right? So that's safe because it's a leaf, right? But going to put bitter nail polish or other things that have chemicals and preservatives in it that can actually harm your child, I would never recommend, right? And so I'm more into positive reinforcement versus punitive. So once you kind of find out what's going on when your child's doing it, why they're doing it, validating their feelings, being patient, right? Sometimes moms and dads, we need timeouts too. And then just replacing that behavior with something else, I find you're a lot more successful with that, right? So, to recap, thumb sucking is very common, especially in toddlers, and will happen a lot of times during big or small transitions. And a patient, gentle parent who is more focused on positive reinforcement than punitive measures is more likely to be successful with stopping thumb sucking or finger sucking. So if this video was helpful, please like, subscribe, share with moms in your world. And again, leave in the comments, how did this help you? What questions do you have? And what videos do you want to hear about? Until next time, remember, preparation over perfection. Toodles.